Coming to work at Katherine West as a new doctor or nurse is an exciting challenge. Before you start, there are a few important lessons we'd like to pass on to ensure your experience working in an Aboriginal community is a positive and rewarding time for both you and the community you will be working with. This is Bulla, a community roughly 55 kilometres from the small town of Timber Creek and around 660 kilometres southwest of Darwin. Bulla is like many communities in the Northern Territory. It is small and isolated, and for someone who hasn't been on a community, very different to what you may have experienced.
No stoplights, red lights, no taxis, everything's walking distance. You know, you can walk down the river, have a swim if it's not, just make sure you ask the locals first where you're going swimming. But that fresh air, you know, you don't get fresh air in built-up areas, and just that freedom.
Remote community life is often a new experience to many, and as a visitor coming to work in a community, it's important that we all remember some guidelines.
When you first go into a community, it is really important to sit back and listen and learn. Ask questions, ask them gently, politely and quietly.
You've got to form a relationship with the community, working well with the community, understand, listen, you know, and try and absorb everything and work in with that. Not at your pace, because Indigenous and communities are different.
As a Karia or white fella, you come into work in the communities, our baggage is of, if you can call it baggage, in white society it's about what you have an expectation. You've had a good upbringing, you may have had good food on the table, you've would have had a reasonable education, you would have had a quality of life. When you come to work in the communities, you actually have to suspend all of that. That's really hard, because it's impossible for us Karia to come into a community without thinking, we've got something to offer Aboriginal people, we can change it and make it better for them. Checking that at the door is the hardest part.
But if you get on well with the community and blend in, that's good. You'll soon know that you're blending, because one thing is with Aboriginal people, they won't tell you when you're doing something good, I suppose. When you're doing a marvellous job, they won't. But as soon as you step out of line, they let you know it.
You got to get into that pace of community life. You know, there's no times, you know, there's no appointments. That's what you got to realize, no appointments, and it's all relaxed, and everything just go out on due course, you know. Everything will just come to you.
Remote health service clinics can be challenging workplaces. Like any new job or working environment, you need to walk before you can run. If you make a mistake, move on, and in time, trust, respect and friendships are developed.
For years, Aboriginal people have watched non-Aboriginal people coming in and out of their community. So Aboriginal people now will sit down, wait and watch you to see whether it's worthwhile for them to invest their time and their energy into that two-way learning process with you. Then you can start talking about lifestyle diseases, changes that you need to talk about with Aboriginal people.
Once you arrive in a community and begin to work in a clinic, there are a number of key aspects that you might not have considered when working with Indigenous people.
I thought, hey, you know, I've come here, I've got something to offer this mob. I reckon I could change this community. I reckon I'm a pretty smart guy with a big education, and I had that took a little while to get that out of me. Minimally the first 12 months of having nobody talk to me for the first 12 months. I thought, hey, why doesn't people actually talk to you? After 12 months and these meetings and running issues, and people started talking at meetings and saying things to me, I thought, hey, well, it's changed again. What's happening here?
Good morning. How you doing?
Developing a relationship is the first thing that needs to happen. You need to take time to develop that relationship. And the way you develop a relationship is being somebody that's non-judgmental, somebody who's respectful, somebody who talks respectfully to people. That's the thing that's going to help you develop them relationships.
That's why some other people in health management outside of Aboriginal health will say, well, why do you spend so much time talking? It's for that very reason, so that we're always building relationship.
You build up that relationship with certain clients or patients, you know. Then you got your mate, there to talk to other community members and say, look, you need to come for these checkups, or, you know, or even just have a yarn, you know.
The relationships are about mutual respect. It's stuff that is already well planted in you when you come to communities, and relaxing and respecting the people around you is really important.
So, have you got a sore throat?
Yeah. Being in a place you really don't know and having to drop your own knowledge system, I think that was the biggest challenge. You know, things don't come on a piece of paper, don't work on a computer. They work off, if you can't build a relationship, you don't progress.
This nurse was just hammering this person there, and I said no. I took her away and said, look, you're going about the wrong way, you know. You need to wait, you know. Do your blood pressure, do your BSL, and get that person to respond on why they're really there, you know. They might have a sore toe, or might be, you know, they're getting the flu, or you got to give the person time to respond. When that nurse went back and done that consult, and I was just sitting there, you know, one side, and she made mates with that person then afterwards, you know, and she found out why the full extent of that illness that you come in there for.
I see with non-Indigenous people is that they push Indigenous people, you know, to make a decision.
So, like, you know that you've got a condition that's called hypertension.
They've got to understand that it takes any question. You've got to sort of over and over. Do you understand what I'm saying?
Do you understand what I'm saying?
If you don't, look, call out to somebody that you know, a health worker or somebody. Come here. Can you explain to this person what I'm saying? And then they go, yeah.
Sometimes we have a problem with understanding English as a second language for our people, mainly for the elderly people. And it's very hard for them to understand and to give them the information when a non-Indigenous staff or nurse gives them medicine, and it's very hard to understand what that medicine means.
Whether you're explaining a diagnosis, medication instructions, or next appointment details, you should always treat people with respect and make sure that your message is understood. Using a translator, simple terminology, or follow-up checks could all prevent misinterpretations of the information you want to convey.
You know, you've always got to treat each person as equal. No matter what colour we are, we got to be equal. But with the Indigenous people, speak in a way that's understandable. I guess not too much jargon. Jargon doesn't get us anywhere, you know. With Indigenous people, it's just yeah. I'll agree to everything you say, just to make you happy and get off my back.
You can't ask too many questions for community people, but sometimes they pull you up and say, nah, we'll just tell you this bit now, and when you get a little bit of trust, we can tell you a little bit more on other things, you know. Not always is just going to come out in flow. We can only talk so much.
When working with Indigenous people, you may need to try different approaches. Age, gender and respect are very important.
Generally, male will see female clinician and female will see male clinician. But when it comes to things sensitive, our men out in our communities and our women will tell you that they want that same sex to see them in that clinical consult.
You also have to be careful about how you speak to older people.
When people start putting their head down and looking at their toe and you're talking, you're getting nowhere. You got to change your approach on how to get that message across. or that treatment, you know, or that you're trying to get that patient to tell you what's wrong with them. So you got to change your approach on that area, you know? Because you might say something that have been offensive to them, and then when they walk at their door and say, yeah, I'll come back, then when you go see them later on, say, no, I don't want to talk to that doctor or nurse. I feel hurt. But little do they know that they just hurt that person.
If you do make a mistake, apologise and move on from it. Don't labour it.
This has to be done so I can graduate and get my certificate.
Building relationships is paramount in working as a team. And in the community clinic, it's teamwork that is the key to providing a system that is going to work.
It's important that you work, we get along and we work together, because that's all you got is me, and that's all I got is you. And we're going to see each other 8 hours, 9, 10 hours a day. We're going to be just about in each other's pocket.
There needs to be teamwork in a health centre environment, because a non-Aboriginal person is never going to really fully understand the cultural implications from a non-Aboriginal person's perspective in relation to health. Health is just one part of Aboriginal people. So your illness as an Aboriginal person, you're not sitting there usually concerned about your illness. That's only one part of it. It's how you being unwell relates to your kids, your family, your uncle, your auntie, your nana. It's looked at in a holistic family perspective in a community, and then the wider implications in that community context.
Sometimes if there's an emergency, a patient may have a lot of family coming to the clinic.
So the family, it could be, 50% of the community, or it could be the whole community waiting outside the door, knocking.
For an Aboriginal person, that one Aboriginal person is related to everybody in that community. So when an emergency occurs, everybody rushes into the community because they're concerned and they're worried about their family member. So you're not going to have their immediate family attend the clinic. You'll have the whole community converge on the clinic because they're worried for their family member.
Emergencies in communities can be very challenging. There may be panic and strong emotions. Whatever the circumstances, you need to work closely with your health worker and to listen to senior community members if they are available. Whatever the emergency, the relationships you have developed and the trust that you've built will go a long way to help in these situations.
From living at Kalkarinji for 6 years, I quickly worked out that us Kariya come in one of two packages. One is we're either really technically proficient at what we do, really great at what we do, or we're Kariya who's really good at communication. And I think understanding that when we come into a community, we're a blend of these things. We're not perfect, and that we can be a good doctor, but we're only as good a doctor as the people we can communicate with and have them understanding what we're doing.
You're at school the way at Ballarat, eh? Yeah? You like it? Yeah? Been playing some footy? Yeah? And you've been well? Yeah. That's good.
When working with Indigenous people, you may need to try a different approach. Here are some examples that might help you. Remember that these are only a few things, and that if you are unsure about anything, you need to ask your health workers, community elders and Katherine West Health Board members. Take time to get to know your community. Be patient, listen and get involved. Don't expect to be accepted immediately. It takes time to build good relationships. You must always make sure that your message is understood. Just because a patient is nodding their head doesn't mean that they understand you.
I think it might be a good idea maybe if we go and get someone else who can help us to communicate and talk about this.
Use plain English and work with your health worker to communicate your message. Be aware of how you talk to community members. You must respect age and gender.
Sorry you done that shop yesterday.
Standing over people
You can't eat that junk food, it's going to kill you.
or touching can sometimes be seen as disrespectful. You need to be aware of culturally sensitive issues. For example, health workers may not be able to treat members of their own family.
How come you couldn't see him? You couldn't even look at him?
No, it's my boys and cousin.
Always remember that if you have any questions regarding these issues, make sure you ask your health workers, community elders and Katherine West Health Board members. It doesn't take long for people to develop strong relationships and for the sharing of knowledge and friendship.
You know, if you stick around long enough in the community, you'll get them, you know, it's a privilege, you know, you learn the language, then you get invited to participate in cultural activities and in community events. You know, it's not always just 4:30 knock off, I'm on call, and then that's it. You know, there's other things in the community that community, they'll come up and ask you, you know, we're having ceremony this week, you want to come along, and it's not too daunting for them, and say, look, we invite you to come and participate in this ceremony. And some nurses take a lot of benefit out of it.
Get involved in things that the community have. You know, don't just work. This is the end of my day, I'll go home. And if there's functions at a community level, like little things they have, like they have these sort of cultural stuff, get involved, you know, ask permission, get involved in them things. And work in with the community.
When you do come out, you need to have your mind open. It's obviously a different world. Aboriginal people do things differently. Your value systems are going to be different to Aboriginal people's value systems. There may be things in Aboriginal culture that may challenge your value system. Don't openly express that if your value system's being challenged. Talk to your colleagues, talk to your health workers or your board members to guide you with that.
I guess make sure they've got good supports even outside. It's good to be able to debrief on the phone to your friends still, or people who understand. Good supports in your management, being able to ring people, and being able to talk to local people and start building those relationships. And if things are difficult and you have to bring up hard issues, still bring them up sensitively. You don't need to dodge the issue, but finding the right way to bring it up in a sensitive, good way is important.
If you're working in a clinic, you got to work with the health workers and that nurse and possibly the doctor, that's your team there. Then, you know, by chance, a community member comes in and you do treatment and they're happy with your treatment, they'll come back and they'll make friends with you. And they'll show you the fishing spots, the good walking area, and that's what you'll benefit from in community life. Because you will find that you will make friends, no doubt about that.
Working on a community offers you the opportunity to become involved in and part of that community. An opportunity to learn about the culture and heritage of the people and to forge new friendships. It offers you the chance to make a difference in your chosen profession, and also a chance for you to make new friends and discover some of the wonders of Indigenous culture.